Here's a live look at downtown Rochester. The Plummer Building lit up in blue. It's part of a nationwide effort raising awareness for colorectal cancers. This afternoon, Rochester Mayor Kim Norton at the Hope Lodge proclaiming March as Colorectal Cancer Awareness Month in the Med City. Colorectal cancer is the third leading cause of cancer-related deaths in the U.S. in both men and women. It's estimated it will take the lives of more than 52,000 people in the U.S. this year alone. Joining me now is Dr. Kisiel. He is a gastroenterologist at Mayo Clinic. Doctor, thanks for coming in and speaking with us. Colorectal cancer is that's actually two similar cancers, correct?
Yes, thank you for having me. So colorectal cancer we refer collectively as those that involve the colon, which is the large intestine or bowel above the level of the pelvis, but it is in continuity with the rectum, which is the outlet, so to speak, of the colon.
Sure, and these can be difficult things to talk about for some people. Does that, this type of cancer kind of have an impact on people getting screened and doing that sort of thing?
Well, we really want the screening to have a beneficial impact on people. So colorectal cancer has often been called the most preventable but least prevented cancer that we deal with. So we have many screening options for patients for them to get tested before they develop any symptoms, so that we can find precancerous polyps and early stage cancers to prevent people from ever getting sick.
Sure, timing really is critical with this cancer. When should people get screened?
So we generally now recommend that people start getting screened around age 45, and the frequency with which they get screened will depend on which testing strategy they use. For colonoscopy, that could be every 10 years. For tests like Cologuard, the stool DNA test, that would be every 3, and some tests that find just blood in the stool, those are done annually.
And how do you know which screening type to get?
I think it's important that you talk to your doctor about your choices. Each one of those tests has been estimated to be very effective at preventing cancer, but they only work if they get done.
Mm-hmm. And talk to me a little bit about death rates. I was doing some research, they've been dropping, I see, slowly, but they are going down. Is that because more people are doing these screenings, becoming aware? Yeah,
exactly. So over the 2000s and the 2010s, we saw more and more people participating in screening. Over the last decade or so, we went up from about maybe 50% of people participating in screening to much closer to 70%. We're not really at our goal of more than 80% yet. And unfortunately, we're also seeing the death rates rise in younger patients, and we're not really sure why that's happening yet.
And colorectal cancers, when it comes to prevention, it's not preventable, but there are those risk factors that you can look out for. Is that correct?
Well, some of those risk factors are modifiable. So you can help prevent colon cancer in addition to screening by not smoking, by using alcohol in moderation, avoiding processed meats and saturated fats, maintaining a healthy weight. You can't control how quickly you're aging. You can't control your sex. It's slightly more common in men than women. And unfortunately, some racial groups are disproportionately affected. It's very important that people know their family history, not just whether or not people have had colon cancer, but also other types of cancers like uterine cancer, gastric, or pancreatic. And it's important that you know whether or not people in your family have had polyps. So if you have a first-degree relative, a parent, or a sibling with polyps, usually we actually start screening those people a few years earlier.
Is there anything people should look out for?
Well, I think for generally people who are not even having any symptoms should start screening at age 45. But I think it's important for patients if they're developing what we call the alarm features, things like rectal bleeding, change in bowel habit, rectal or abdominal pain, involuntary weight loss, or even running a low blood or iron count. Those things should all be investigated.
Okay, Dr. Kisiel, thank you for coming in and appreciate you sharing your insight.
Thank you so much for having me.